I found two topics very interesting for me from my point of view. The first one is regarding secondary myeloid malignancy post-CAR T cells. So actually you are treating patients with CAR T cells for lymphoid malignancy, and they can develop, some of them develop myeloid malignancies, secondary. So the conclusion of this presentation was that usually there is some predisposition with the gene mutation in those patients, so they develop this myeloid after CAR T. I would say yes, I agree with this hypothesis, but for me, it's not enough, because you can have these predisposition mutations, but you never develop MDS or acute leukemia, for instance. But my hypothesis is really this is a cytokine matter, So if I have an advice for the young researchers, around Europe, because now in Europe, it's really to focus on the role of the cytokine and the genesis of leukemia. This is very important. And we all know after CAR T cells, there will be some cytokine storms or some disbalance in the cytokines equilibrium. So it can be the key to understand this. This is very important. And now we are opening the era of in vivo CAR T, which is something very attractive, I would say, but we need to be aware regarding this complication, because we cannot control everything, and we need really to work on this cytokine matter. The second topic, it's really far from this, but the treatment with Menin inhibitors, So nowadays we have more and more publications or communication regarding these Menin inhibitors. So for now, a small number of patients can benefit of this, but I think we need to think about enlarging the indication and using some combination so that we can bring something new to the treatment of MDS and AML.